Good afternoon, everybody. Hope you can hear me. It looks like there's only going to be about 3 or 4 of us on the call today. Kind of dwindling a little bit. So if you want to ask questions anytime as we go through this, just let me know. I'm just going to go through the PowerPoint real quick, and then we'll go ahead and I'd like to see how everybody's planning on either going back to work or if anything's changed or changing. It'd be great to just share some things. So I'm I'm going to go through this fairly quickly. So again, thanks for attending. The agenda is around preparation workspace guidance, opening up again, and then we can just have a roundtable discussion if you'd like. I'd just like to hear what you guys are doing, and then what we could do to help. The housekeeping, it says all participants will be muted. As I said, I've got it set that you can unmute yourselves since there's only a few of us today. So feel free to unmute yourself as we go through this if you want to ask a question or if you want to interject anything. Or you can use the chat feature as well. I'll try to keep an eye on that. Excuse me. And then if you need to leave the meeting, down in the lower right-hand corner, you can click the leave meeting button, and you can rejoin at any time if you want to rejoin. Excuse me. All right, so preparation workspace guidance, utilizing the OSHA guidance on this. So it's just steps to reduce the exposure to the coronavirus and then classifying the worker exposure to the coronavirus. The excuse me. So OSHA has, and I'll give you, I think did I give you the link here? Yeah, here's the link to the document, guidance on preparing workspaces for COVID-19 that OSHA has released. So that publication, if you want to utilize it, and again, this is just a summary of what the OSHA guidance is that I'm going to go through in the first part of this. But if you have any questions, let me know, and we can discuss it. The OSHA recommends that you set up an infectious disease preparedness response plan. I do have some further guidelines from another group that I'm in if you're interested in setting up a preparedness response, and I can send that to you. But it's just around, and really, if you already have one for other infectious diseases, you can modify it to take into consideration the COVID-19. And then also the steps that employers should take is following the federal, state, and local recommendations around absenteeism, need for social distancing, and all the other things that I'm sure everybody's been talking to for the last month and a half, 2 months. Excuse me. Implement preventive prevention measures. And again, most of these are just what we've been talking about the last month and a half or so, but it's just reiterating it through OSHA. Promote frequent hygiene, provide sanitation, waste baskets and tissues in the workplace, discourage sharing equipment. A lot of these are just common sense, but it's good to have a plan in place and share it with your employees just so everybody's on the same page. And then develop policies and procedures. And these are just some of the items that they talk about for your policies and procedures. And for those of you on this call, I've created a return to office policy template that you can take off of for your organization if you want to put in place a policy and procedure. We'll talk more about that later on in this presentation, in this webinar, that you can utilize to, customize to whatever the situation is within your organization and your industry. OSHA talks about controls. They have 4 controls that they utilize. Engineering controls has to do with the facility. Administrative controls are more around policy. And then you have safe work practices. With a infectious disease, it's around hygiene and regular hand washing and things of that nature. And we'll show on the next slide about the different tiers. Safe work practices controls involve or applicable to every tier within the pyramid. And then PPE, the personal protective equipment, when to utilize those. So this is the occupational risk pyramid for COVID-19 presented by OSHA. So of course, the larger workforce is in the lower risk caution, medium, high, and very high. So when they classify very high, the vast majority of the very high are around healthcare workers and lab workers. And those that are dealing with the actual infected persons that can garner or do garner aerosol generating infection, passing the infection on. And so around engineering and down below, it shows the controls that you should have in place through the OSHA guidance. Engineering, a lot of it's around HVAC and air handling. They have airborne infection isolation rooms, which a lot of hospitals and labs have. So they're segregated from the rest of the facility. Administrative, putting into place procedures and protocols that all the personnel need to follow if you're in very high risk exposure. And then all the PPE that's involved, whether it be in gowns or face masks and so on and so forth. The high exposure is around, mostly around healthcare delivery as well. It could be more around family doctors or pediatricians, nursing that would that would come into contact with people that would be infected. Ambulance drivers, EMTs, mortuary workers, things of that, jobs of that nature, and then what controls that they need to have in place as well. And I don't believe any of the high or very high pertain to any of our clientele, but it's at least good to know. Medium exposure risk. These jobs are more in the general public, with people that interact with the community. Could be a lot of retail, people that do face-to-face or are transacting with people face-to-face. So engineering is toned down for the medium exposure risk. If you've gone into Lowe's or Kroger or someplace like that, you'll see they put up like plastic barriers at the registers, and most of the workers are wearing face masks. Administrative, they've put in a lot of social distancing policies and procedures, not letting people come into different parts of the business or having to wait in line. They put tape on the floor for 6 feet apart. So it's just implementing safeguards for the medium exposure. And low exposure, no additional engineering recommended, or PPE, no additional PPE recommended if it's not already in place through the type of industry that you're in. And then administrative is just communicating, letting people understand what the public health information is out there from government agencies and how to implement that. So that's the OSHA. So through OSHA, they have those guidelines. Again, the link is there. The White House has developed a Opening Up America Again, and these are the criteria. I'm not going to go through these in detail. I'm sure most of you have heard what the criteria are. And these criteria are really guidelines for the states. So they've implemented it at the high end, and then they've provided that to the states to roll out in the best ways they see fit for the different states. So they have criteria, and then core state preparedness. So they work with all the governors and the health departments in each state, putting in place testing, contact tracing, working with them on healthcare system capacity, because a lot of states had more hotspots than other states, so they're helping, or they did help, which I hear a lot of the hotspots now are taking down the temporary hospitals. I was on a call at noon, and they said that they've taken down the COVID hospitals in Chicago, Miami, excuse me, Boston, and New York as well. A lot of them in New York. So they're not seeing as many cases, so the capacity on those health systems has been decreasing. They're just concerned, and they're trying to ramp up if there's a second wave. So that's why they're putting plans in place that hopefully after this initial wave that we don't have a huge second wave. They have 3 different scenarios that I've looked at, where it could be just a rolling wave, or we have a big spike that's bigger than the current one we have, or that it'll be just a roll off. But there's going to be some type of second wave, is what most of the experts say. It's hard to say. I don't think anybody really knows what's going to happen. Employer phases guidelines through the White House. All the phases they have different PPE, temperature checks, the sanitation piece of it. So if you're in the workplace, you should present or provide like stations for the hand sanitizer, tissues, non-touch waste baskets, just things of that nature. So they're just guidelines that they've provided. Again, these are guidelines from the White House that they've provided the states to help roll out. So the states can take this advice or not and develop their own. The recommended 3-phase phase-in is phase 1, which we're already in, encourage telework, return to work in phases, close common areas, minimize non-essential travel, and consider special accommodations for members of the vulnerable population. Phase 2, again, it's just ramping that down, ramping those phase 1 restrictions down till we get to phase 3, where it's unrestricted staffing of work sites. So I'm just going to provide, and again, I'm going to go through these real quick because they don't apply to everybody, but our offices and our region that we work with is West Virginia, Ohio, Kentucky. So I'm just going to go through these guidelines, these state guidelines quickly. If you have any questions, again, as I'm going through this, just go ahead and chime in. You can unmute yourselves. West Virginia started, there's called West Virginia's Strong the Comeback. And again, the links to these plans are in that previous slide, which I'll send out to everybody, so you have them. Week 1 for West Virginia, they started the earliest, started on April 24th, and they opened a lot of the healthcare. Week 2, which started last week, small businesses were allowed to go back, professional services, so they, and outdoor dining at restaurants. So the outdoor dining, a lot of restaurants still are just doing takeout. From what I understand, the limited amount of business that they could obtain from outdoor dining and social distancing. Some restaurants are still holding off because they don't think they can be able to bring in as much revenue with the limited opening, that they're going to wait. West Virginia opened churches and funerals on May 4th. And starting this week, and they have a rolling, they're going to be opening different aspects of these weeks 3 through 6, starting this week with West Virginia. And they're going to announce these separate weeks 1 week prior to the opening for West Virginia. And no timeline for reopening nursing homes, entertainment venues, and gatherings of large people larger than 25 in a group. Ohio's is called Ohio Responsible Restart Ohio. On May 1st, the healthcare was reopened for medically necessary procedures that don't require an overnight stay. And then on May 4th, manufacturing, distribution, construction, and general office environments were open. They have on their website, again, that's listed there, mandatory safety requirements that pertain to all these. And again, I wasn't going to list all these here. So today, limited consumer retail and services today under a limited opening has started today. And then on the 15th, salons and barbershops and outside dining is going to start in Ohio on the 15th. And those mandatory safety requirements, kind of like salons and barbershops, I think you have to schedule an appointment. You can't go into a waiting room. You have to wait in the parking lot and wait until they come out and get you and bring you in. You have to have certain PPE and all on while they do that. There are continued closures, very similar: schools, daycares, adult care, senior centers, and entertainment. Kentucky's is called Stay Healthy at Work. They open places of worship on the 9th. On the 11th, construction, horse racing, of course, horse racing in Kentucky. Right, Debbie? And then manufacturing, distribution, office-based businesses. So just the myriad government offices. So this is just a rollout as they go. So there's a little bit more detailed on the dates that they're opening it. Ohio and West Virginia kind of are waiting as they communicate more of the rollouts. We talked about the return to work policy that I've template that I've created, and we'll share with anybody that's interested. Just send me an email if you're interested, and I can share it with you. So it's different sections: employee responsibilities. It's just what is expected of the employee. And then office preparedness, what you're going to do as preparing the office ready for your employees to come back in whatever manner you're going to have them come back in. And again, this is pick and choose. There's things that are probably not addressed in here that you'll have to address. There's other things that are addressed that are not necessary for your work environment. So it's just a template. Talks about internal office meetings, what to do with internal office meetings, and client and visitor meetings. We talk about a lot of places are requiring when an employee or even a visitor checks in that they have to have their temperature taken, masks, and it's kind of fuzzy when I read some of the requirements or recommendations. It's kind of fuzzy whether it's required or recommended on the face masks. And maybe you guys have somebody has a better handle on it than I do. Sometimes I read it sounds like it's mandatory, other times it's not. So again, take this work policy and conform it to however you see the best fit for your organization. Business travel. Most recommend that you don't travel locally to meet with clients. No international travel for sure, and really highly discourage any domestic travel. And then having a communications plan in place. This policy is written so that you present it to the employee and they can sign it. So, and sign it that they understand and acknowledge that they've been informed about the policy. We have an on-site protocol, and Telepoint does currently, and it most likely will change as the environment changes. So, we'll confirm with the client to make sure that anybody that is at an office, if we're coming on site, and again, we only want to come on site if it's absolutely necessary. If something is down that we can't solve remotely, then we ask that that we can solve it remotely. But if we do have to come on site, these are things, and we'll send you an email before come on site that we have to confirm. So we want to confirm none of the client's staff is ill, and also that they're not being housed with family members that are ill. And we want to make sure that wherever we're going to be working, if it'd be best if you could sanitize the location. I mean, a lot of times that's not something that you can do, but if you sanitize it and just prepare it just so that we can get in there and do our work, and then take care of it and make you guys whole again and get you up and going. Adhere to social distancing, and then our tech will call when they arrive at your location, and then usually what we do is we'll go physically check in with you when we leave. So when we're finished, we ask that they just work alone if they can, and then we'll just leave, and then we'll call you when we've completed. We'll have PPE, we'll wear gloves, face mask, we'll have antiseptic, and then we'll dispose of the gloves, prior or after we're finished with the work. As I mentioned, the return to office policy template I have for you. If you do need face masks or other PPE, thermometers, we purchased some thermometers that work well. They're non-touch thermometers. This iHealth Labs has a good assortment of PPE that you can purchase, and a lot of it's in stock. So I would recommend that you take a look at this iHealth Labs website if you get a chance, if you need a PPE. And if you need any assistance on any of this, or if you're interested in the return to office policy, just ping me. But if you need any help from our support people, our team, we've got the support@telepoint.net. There's our West Virginia and Cincinnati area phone numbers. And then, of course, our portal. If you go to our website, the portal's up in the upper right-hand side, and you can click on there and you can submit requests that way as well. Question and answer. If you want to unmute yourself, if you notice at the bottom, you'll see the microphone that has a red line through it. Just click that, and that will unmute you if you have any questions. Other than that, that's all I have. So does anybody have any questions? And I'd like to ask if anybody has thought about and are planning on returning their employees or team to work. And also, I'd be interested to know if there may be some of your team members that are not going to be returning to work, if they're going to just keep working remotely. Has anything changed in that regard? Anybody want to chime in?
This is Kingsley at Rio Grande.
Hey, Kingsley, how are you?
Well, I'm a little bit feverish today, but I am distanced at home.
Okay, that's good.
We made it through the posting of grades. We have been closed down since spring break in early March. And now all the discussion is, what does it look like as we try to enroll students for the fall semester, have some students enrolled for summer sessions. And I think we've pretty well demonstrated to the best of our ability that remote work is okay for us administratively, but
Hmm.
that doesn't work for instruction. So we're going to have to play it by ear, follow the governor's mandates, and keep in touch with everybody. But we have institutions all over the state of Ohio that, and across the nation and the globe, that are all in the same boat. We have
Hmm.
the exact same challenges, and I appreciate forums such as yours and the others that I frequent, because it makes you feel less isolated when you can talk to your friends and hear how they're approaching their own challenges. So
I agree.
thank you very much, sir.
You're welcome. Kingsley, can I ask you a question?
Sure.
What's your gut feel about universities going back in the fall?
The first thing we did was we delayed the start of fall on the schedule by 1 week, just to give
Okay.
us some breathing room. Um, I don't have a crystal ball,
Hmm.
but I am. I hate to say I am pessimistic about things,
Okay.
but I think other great leaders, whether it's Bill Gates or Fauci and Bricks, they have all shown that this is a much larger matter, and that we should consider how we work moving forward with other ways of being normal. And I think that as global climate change and other things start piling on this, we're not going to have any rest. And that just comes from an old hippie tree hugger. But
Okay.
Pat and I live on 70 acres south of campus, and right now that the rain has stopped and the sun is coming out, believe me, there's no better place that I want to be isolated today.
You don't mind. You don't mind. Yeah, you don't mind being quarantined, do you?
Well, I have a brand new granddaughter up in Connecticut that
Oh, that's
we were
hard.
supposed to see, and my retirement is supposed to occur sometime. So, we'll do what we can to keep life normal. And our survey came back from students. One of our biggest challenges in education, and especially for schools such as ours that are open enrollment community college with some private students, private institution students, is internet connectivity. And I don't know how Washington will approach this, whether it comes up as strong as rural electrification
Mhm.
came up in universal service, but it definitely changes accessibility to education when there are um, laws of physics and barriers between us having those access. And I'm not
Yep.
even talking about the economic barriers, but just
Hmm.
down here, and the areas around Barbersville and everything, you
Hmm.
just can't push wireless through the hills. It just
Yep.
doesn't happen that way.
Yep. Yep.
But
Well,
anyhow, we've
yeah.
we've lived through the landing of the plane. It wasn't a crash landing, but it was like 9/11, and everybody got to the ground.
Well, I appreciate your insight. Thank you.
Hope everybody in your families are well.
They are. I hope you do. I hope you get to see that grandbaby here soon. Kathy, Debbie, do you have anything to share? You guys good? All right. Um, as I said, if you need anything, we're here to help. If you just reach out, email, phone call, and again, I appreciate you attending today's session. With that, I hope you have a good rest of your day and rest of the week. Take care.
Be well.
Bye.